This afternoon I'm talking during the session entitled The Value of Sustainable Healthcare, and I'm placing this within the perspective of the current debate on the future of Europe and why I think it's so important for health to remain at the center of the European agenda. It can't be allowed to move to the periphery, as is being suggested by some, because it's far too important, but also because what determines people's health and how we can respond and organize ourselves to improve health and well-being transcends very much from the local level right up through to the national, European and global level, and we can't afford to take one chunk out of the equation because we would risk really failing to continue to progress with the health of Europeans, which has benefited greatly over the past half a century. By sustainable, I mean that we have enough resources to do what people, citizens in our democratic societies expect that needs to be done. So, for example, if we don't have enough healthcare workers to provide the care which society values and expects, then your system is not sustainable. Equally, if we don't have the financial resources to cover and fund the therapies which people rightly or expect and value and think that should be provided by the health systems, then the system is not sustainable. Now, obviously, it's all down to a balance between supply and demand. And I've taken it away from just personalized medicine because one can find a similar discussion in the area of the healthcare workforce, for example, where health systems can become unsustainable if we don't produce quantitatively and qualitatively the healthcare workforce that we need to meet people's needs and demands in the 21st century. It's not only about money, it's about the way you organize yourself, the way in which you collect that money, the way in which you prioritize and target the spending of that money. We talk about value, but more or less the problem is whose values. There's intergenerational value differences. There are value differences between the poorer and the richer, between people in different parts of Europe. So I think that we need to become a bit more precise even when we talk about the value, because we need to be explaining better what we mean by the value. But most people will not argue around the value. What people will argue around is the funding, the transparency, the timing of financial outlays, and how, in a way, we can bring all of this together. Now, personally, I think that it's very difficult for individual member states to try and put this all together on their own, duplicating, replicating, competing. The world is changing, and we must find ways in which, whilst respecting the sovereignty that needs to filter down even to local level, because there are certain health and healthcare decisions that are best taken very much at local level, co-created with the communities you are serving. But on the other hand, there are other architectures, systems, financial outlays that are best carried out when there is investment at supranational level. Perhaps coming from a smaller member state, from Malta, we feel the need to do this, perhaps more than other countries, because typically smaller countries, even in terms of the globalization of market economies, have always been hit earlier and more harshly by environmental changes. Similarly, as the healthcare environment is changing, smaller countries are often the first ones to realize that the game has changed and that we need to find new solutions. I think perhaps just to end with the importance of all of us, be as public health advocates, industry, politicians, patients, need to really lobby over the next few months to ensure that health really remains a core objective within the future of Europe.